Hey guys, welcome back. Today we're going to be chatting about the medical and surgical management of endometriosis. Now, there are a lot of myths surrounding the surgery for endo. Although you can remove the lesions surgically, it's not a cure, which is unfortunately what some people still believe. So there is about a 50% recurrence rate with endometriosis surgery, which is really high. And contrary to belief, not all women require surgery immediately. Usually if the lesions are attached to vital organs like your ovaries or tubes or bowels and things like that, then obviously surgery is required then. But it really depends on where your lesions are, what grade of endometriosis you have, and that's something that you and your surgeon would discuss at the time if it comes to it. When it comes to surgery, excision surgery is the gold standard. So this means that it's the best surgery we have available. The other type of surgery that's really common is ablation surgery, which is effectively where they're burning off the lesions. But if you're thinking of it like a tree, you can go in and shave off the leaves and cut some of the trunks, but all of the roots still exist. So with excision surgery, you can actually go through and the surgeons can effectively remove more of those lesions and get the roots of the lesions. So that's why it's the best surgery that we have available. And if surgery is something that you and your medical team have decided you need, it's best to hunt down an excision specialist. And there's only a few in each state and city. Luckily in Australia we have a lot of them. So make sure that if you are going down the surgical path that you're looking for an excision specialist. In terms of medication, there's a lot of things that can be done, again, to manage your pain and your other symptoms. So one of the most common things that people are often prescribed is anti-inflammatories because endometriosis is an inflammatory condition. So sometimes anti-inflammatories do work for some women to help reduce pain. One of the other things that we often prescribe to women in the medical field is oral contraceptive pills. Now at the moment we don't have a lot of really sturdy research behind us to suggest that the oral contraceptive pill will help all women, but it's still one of the things that we prescribe most to women that are diagnosed with endometriosis. If you are prescribed the oral contraceptive pill, all I'd say is make sure that you do your own research, chat to your specialist team, chat to your doctors, and if you feel like it's helping you, then absolutely go for it. If you're not quite sure, then maybe speak to someone that is an expertise in more of the natural side of things. One of my favourite go-tos in the area of natural medicine is Nat Kringoudis. She specialises in women's hormones and fertility, and she's written a book with a gynecologist that explores the contraceptive pill and its pros and cons. So that's somewhere that you could start, and of course if you're looking for more information on that as well, you can head to Endometriosis Australia. They've got lots of videos on the surgical and the medical management of endometriosis. Unfortunately, at the moment, there's not a lot of research to guide us on the use of natural medicine and other natural therapies. But that's not to say it doesn't work. And it's one of those things that a lot of women do swear by in their management of endometriosis. So there is some evidence to suggest that acupuncture a couple of times a week can be quite helpful. And it might even help to reduce the pain associated with endometriosis. There is also some evidence to suggest that some herbal medicines might be helpful as well. So again, my go-to is Nat Kringoudis here. And if you're looking for a chat that I did with her a couple of years ago, I actually sat down with Nat and we chatted all about how to keep your hormones happy. So we'll link that in the bio down below as well.